everyone, and welcome back to our podcast.
This episode, we had Dr. Roselynn Dean on. Dalnaz, what did you enjoy about our discussion?
I really liked how she had different perspectives on how it is to work in the medical field in urban areas and rural areas, because we talked to her about how what she encounters in the rural areas she works in now. So it was really cool that she had a diverse set of experience. What about you?
I agree. I think this is obviously our first person that we've had on in the medical field, and it was a lot different than I imagined. She provided a lot of insight into how misinformation affects medicine and the medical community, and I really enjoyed that.
I also did. Well, thank you so much, everyone, and we hope you enjoy.
So, can you start off by telling us a little bit about your educational background?
Sure. After I graduated high school, I went to East Central University where I did my undergrad training, where I graduated the George Nye Award, which is the top graduating senior. Then went on to medical school at OU, and then completed my residency training at Integris Baptist. That residency program, where it was actually called Great Plains, was the name of the program, where I served as chief resident, and then came back to small town America and started practicing medicine.
Awesome. In college or medical school or even high school, were you taught about news bias and how to detect it?
So that's an excellent question. The answer is no. We never had any specific training in terms of detecting news bias. Probably the closest that came or that would detect any kind of bias was actually in college, whenever we would research different topics and they would help teach us where to look for different sources of information, determine the validity of that information, and if that was a reliable source or not. And so when we were researching, topics across the board, that was probably the closest that we got. And probably best the best information we learned from that was to learn if there was a goal for why they were telling this information. Was there a bias there in terms of, were they trying to get us to buy something, or were they trying to get us on board for whatever reason? Are they trying to promote a political purpose? Are they trying to really just various things that they may be trying to promote? So that would be the closest, but not news specifically.
So kind of moving from education to professional, can you tell us more about your professional background, and then we'll go into misinformation there?
Sure. So probably the most relevant would be when the pandemic first started. I was working as chief of staff at the Okemah Creek Nation Community Hospital. And when everything got shut down, it looked like things were going to be okay. Actually changed jobs and am now working at an outpatient community practice with SSM Health. And in the transition there, I worked at Shawnee Hospital for 2 months as a physician, taking care of COVID-19 patients.
All right. Do you think misinformation has become more common overall in medicine or out of medicine? And if so, have you noticed a significant increase in recent years?
So I don't know that the misinformation itself has increased so much as the weight people put into misinformation. So from the time I started training in medicine, people would always come in with things that they had heard, like old wives' tales, basically. But then as a physician, when you say, oh, no, well, it's actually this way or that way, or you should or should not do this, it was valued opinions and they would listen. Versus more recent years, more of what we saw was that if someone read it on Facebook, it held just as much weight as what a medical professional, like in my situation, if I was telling a patient that, they may or may not listen.
So with kind of hand in hand, with that, you kind of answered this, but so as a medical professional, has people's respect for your opinions, changed more recently?
I think in the height of the pandemic, it had definitely, there was a shift. It really depended on the patient and the relationship I had with the patient. If it was a patient that I had followed with them for a while and I'd helped them through other medical conditions, they definitely had a lot more respect and confidence in what I would tell them as a medical professional versus when I opened the clinic and I was getting new patients in who maybe didn't know me as well, then those patients may be a little bit more hesitant. So yes, I am happy to say though, I do feel like in the last year or so, things have gotten better. As far as there's starting to be a little bit more trust in the medical community again.
You kind of answered this in this question, but how has misinformation affected you professionally and or personally? If you want to add anything onto what you just mentioned.
Yeah, sure. So as a professional in family medicine, a lot of our job is education, teaching patients what's going on, how we're going to treat them, how we're going to make their lives better, and getting them to understand and buy into the treatment plan. And when we spend a lot more time with that education because there's a lot of hesitancy or concerns about it because of what they may have read through social media or other things, then it does take a lot more time through the day to do that education, which then, and of course, when you hear the same thing over and over because Sally Joe posted something and everyone read it, now everyone's coming in saying the same thing over and over, and especially if it's not accurate, then that can that can contribute to burnout from a medical professional standpoint because you're repeating yourself over and over and over, and basically almost competing with the lay person with whatever they said and the context that they said it.
Mhm.
With like, was there around COVID-19,
Mhm.
you said you like switched jobs. Did you see a difference from the like COVID-19 like misinformation? And do you think that if still affects the medical community?
So, um, so I was working in the outpatient clinic there. I was just more kind of overseeing the hospital operations to an extent. And what I was seeing there was patients coming in with COVID-19 and couldn't be shipped out to hospitals beyond, because it's a small hospital, there are very limited capabilities there. And we couldn't ship people out. And so there are literally people on vents in the hospital, and we are trying to get the medical care that they need. And then I would leave the hospital and drive down Main Street going home, and it was like nothing was going on. So there was a complete disconnect between reality that I was experiencing from moment to moment as I was at work versus going home and in our daily lives. So that versus when I went to, when I started with SSM, I worked in the hospital, and basically I was taking care of overflow COVID-19 patients because there were so many patients. And that was hard. That was around the time the vaccine first came out, and we had patients who were eligible for the vaccine at that time, and they were coming in, and I mean, several of them ended up dying, and they would be coming in and their eyes were huge and they would just go, "Doctor, am I going to die?" And of course you're going, you're trying to reassure them and tell them, you're going to do everything that you can do for them. And it's true, we did. But we can't save everyone with COVID-19. That's why there were so many deaths. And that was really hard because a lot of those patients were eligible for the vaccine, and it could have really saved their life. And because of things that they had read on social media or whatever, there was a lot of hesitancy with it. And that was a really hard experience. And then from there, when my clinic opened, um, it was really hit or miss. It just really depended on the person, the faith they had in medical in general. And, like I said, it made a difference if these were patients that I knew, if I didn't know, and if I'd helped them before, because I had patients who followed me from my other practice and things like that. So in that situation, if they had known me and I was able to care for them, it didn't impact it a lot. But for patients who were seeing me for the first time, it was hard for some of them to listen to what I was saying as a physician versus what their neighbor down the road was saying about it and their experiences with it. They didn't really differentiate that. As a physician, I have a lot different take on it and have read a lot of medical literature and what's being done from a medical standpoint to help them. So yes and no. I know that's not a clear-cut answer to your question, but it's kind of a complicated situation.
From what you've described, it seemed that sometimes disinformation could lead to fatalities. So how could one mitigate the issue? How could an individual go about it? You know, if they see a social media post that makes them feel fear against the vaccine or medication, anything like that, how should they be assured that, you know, that may not be true, or how can they do their best research?
So I think that's an excellent question. And I think that's true for any time you hear information, your first thought should be, what is this person trying to accomplish? Or do they have a goal in mind? Are they trying to push some kind of agenda? Are they trying to help me? Are they trying to, what's their goal in communicating this information? And that's probably a lot of what you guys are doing with this podcast, is trying to get people to stop and think, is this something that that someone's trying to push an agenda on, or is this unbiased? And so I would say probably the best thing you can do is step back and say, okay, this is what they say. Are they trying to help me? Are they trying to push an agenda? That would be number one. And then number two is find other sources. So don't just take one person's word or one organization's word. Look around and be open to other point of views. One of the controversial things was ivermectin. And so there was a lot of talk about ivermectin. And so as a professional, I read the research on it and made up my own mind on it. But that was looking at different sources, looking at different studies, looking at results of different places. So generally organizations are fairly safe places to look for information, like the CDC, or I know a lot of people are kind of hesitant with government websites in this day and age, but generally the information that gets published on those websites are peer reviewed or have some kind of other organization looking at it. So if you have another party that's approving that information, that obviously helps. But I think really keeping open mind, and then talking to someone that you trust that is in that field. So for example, I'm a physician and I have a lot of medical information, but if I'm going to build a house, I'm going to call a carpenter or architect. I'm not going to try to go build it myself because that's not my area of expertise. And so talking to people within that field that's going to have that information and have that experience.
I'm just curious, coming from like medical school and then into a like after doing all the necessary things to become into your position and going into a rural area and performing medicine in a rural area, how does that differ from what it would be like in a different area?
So that's that's a fun topic in and of itself. So you would be surprised the difference in culture in 70 miles. And that's actually something that comes up not infrequently during visits with patients, is that even the culture here versus the culture in Ada versus the culture in Oklahoma City are completely different. Even though it's all within the state of Oklahoma, people have very different experiences. They get very different exposures. And so, in practicing in a metro area, you have every specialty at your fingertips. You have a lot of additional assistance and backup versus coming and practicing in a rural area. And so, whenever you talk about something like what happened, I'm one voice compared to all their neighbors they're hearing, versus maybe someone who works or lives in a metro area and they see me and they hear the same thing, and then they hear one thing, then they go to another provider who tells them the same thing and another provider who tells them the same thing, it gets reinforced versus you're the doctor for the community. Like, and so I feel like that kind of washes out that voice a little bit as far as trying to provide that guidance.
All right. Well, Lauren, do you have any other questions?
I do not. Thank you very much for coming.
Yeah, of course.
Is there anything you'd like to add before or?
No, I think what you guys are doing is really awesome. I think that not just from a news standpoint, but just information in general, whenever you hear something, you should always take a step back and think about where it's coming from and what the person's agenda may be in any phase of life, honestly.
Well,
Never
thank
take
you so
anything
much
as
for your
value.
time.
Well, thank you. Have a good day.
You
Thank
too. Bye-bye.